Hello, everyone, and welcome. Our thinking point for today, well, it's afternoon here, this afternoon, is something that's more concrete than our usual abstract topics, and it's a sentiment which is actually nothing new, but it's a concept which is often just brushed under the rug. And it's the sentiment that our modern healthcare system may be structured the wrong way. It might be structured incorrectly. For context, I've been a medical doctor in my countries for 7 years now. For 7 years. And in the first 2 years of me being a doctor, it was a very nice experience. It's a dream come true. You get to treat your patients. Most patients are happy, and you go home and you do the same thing again the next day. But as the years went by, the more I realized that many of the patients were actually coming back with the same problems. Their symptoms recurred. Their diseases, once controlled, are again uncontrolled and needed prescriptions once more. It became like a cycle. It became circuitous, like a wheel. One day, the patient is treated with medications, they get better, but they eventually relapse, they eventually go back to the state they were previously in. And I read an article a year ago. It was under the American Journal of Family Medicine, which said that the current healthcare framework is actually one that is geared towards treatment. The current healthcare system is one that puts a premium on specialists, on seeking specialized care, and goes without saying that in doing so, there is a neglect on the primary care level and on the primordial care level, which is the preventative stage in the healthcare system. So there's basically too much emphasis on treatment and not enough on preventative measures, on prevention. A concrete example of this would be in my country. For this year, the top 3 leading causes of mortality, which is death, are cardiovascular diseases, second are malignancies, cancers, and thirdly are cerebrovascular diseases. And a commonality among these 3 top causes of morbidity is that most of these are what we call NCDs, non-communicable diseases. And most of these are lifestyle diseases. And lifestyle diseases, as the term suggests, are those which are caused by, or at the very least, aggravated by a patient's lifestyle. Does the patient smoke, drink alcohol? What kind of diet does he or she have? Does he consume a lot of junk, a lot of fast food, a lot of fried foods? Lifestyle affects non-communicable diseases. But even so, there is a disproportionate budget and thought coming into treatment rather than prevention, when in fact it is actually probably in the primordial or in the prevention level where a greater amount of effect can be done, because these are lifestyle diseases, these are NCDs. And nonetheless, the focus, the emphasis is on treatment. And we all know that when the emphasis is on treatment, the damage has already been done. The disease has already occurred. Secondly, when the emphasis is disproportionately on treatment rather than on prevention, there is a considerable risk, which we see more often than not. There is a considerable risk that the patient, once treated, will eventually revert back to his or her original state, precisely because the patient's lifestyle has not been modified. It's the same. He's still consuming the same things. He's still drinking alcohol. He's still smoking cigarettes or vape. The disease will continue to recur. And when it does, it will probably be at a worse stage. And to close today's rambling, I'd like to cite also a fellow YouTuber, a big YouTuber. I'm sure probably some of you are familiar with him. He's a former neurosurgeon in the United States. The page's name is Gooby and Dooby. He echoes the same sentiments that probably our modern healthcare system is structured incorrectly, to put it bluntly. There's not enough emphasis on the primary care and on the primordial level, which is prevention. And there's too much emphasis, bluntly speaking, on the treatment level, on prescriptions, on medications, because frankly, that's where the money is. Just a food for thought for all of us. Thank you very much for bearing with today's ramblings, and I'll definitely see you again soon. Stay safe, and I wish you all the best.